Good afternoon, myself Doug Sadaria. I am from third year B physiotherapy student, and my today's topic in the medicine is the acute, minor, and major pulmonary embolism and the signs and symptoms of the rheumatic fever. First, the introduction of the pulmonary embolism. The pulmonary embolism is the obstruction of one or more pulmonary arteries by the thrombus formation. Thus, thrombus is originating from the deep vein thrombosis from the lower limbs. The etiology and the risk factors of the pulmonary embolism. The causes are the DVT, prolonged immobilization, major surgeries, fractures, especially hip and the pelvic fractures, malignancy, and the pregnancy. The risk factors are the obesity, smoking, oral contraceptive use, previous DVT, and age. The pathophysiology of the pulmonary embolism is the blood clot. First, the blood clot formation occurs in the deep veins. Then the thrombus detached from the later it travels through the venous circulations. Then it enters into right atrium, then right ventricle, and finally in the pulmonary artery. In the pulmonary artery, the vessels get obstructed and resulting in the impaired gas exchange and increased pulmonary pressure, resulting into respiratory and cardiovascular compromise. The acute minor pulmonary embolisms. The obstructive of the small branch of the pulmonary artery involving a limited portion of the lung tissues. The clinical features are the mild dyspnea, mild chest discomfort, slight tachycardia, anxiety, and mild hypoxemia, sometimes also asymptomatic. Acute major pulmonary embolisms. The large embolism causes obstructive of the major pulmonary arteries, resulting in the severe hemodynamic compromise. The clinical features are the sudden severe dyspnea, central chest pain, severe hypoxia, hypotension, cardiogenic shock, and cardiac arrest also. Now the rheumatic fever. The rheumatic fever is an inflammatory autoimmune disease that develops following untreated group A beta hemolytic streptococcal throat infection. Commonly affected systems are the heart, joints, skin, and brain. The pathophysiology of the rheumatic fever is the streptococcal throat infection. It targets the immune response, close reaction of the antibodies, inflammation of the tissues, then affects the heart, joints, skin, and CNS affected, resulting into rheumatic fever. The major signs and symptoms of the rheumatic fever are the joints, major criteria, carditis, tachycardia, murmurs, cardiomegaly means heart failure, the syndrome chorea, involuntary movements, emotional instability, pink ring form shaped skin rashes occurs, subcutaneous nodules such as small painless nodules over bony prominences. The symptoms are the fever, fatigue, joint pain, paralysis, etc. The management and the prevention are the first. The management it can be cured by the penicillin therapy, anti-inflammatory drugs, bed rest, and cardiac monitoring. Prevention, early treatment of the sore throat, good hygiene, and regular follow. Thank you.